Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. We must have experienced or seen the incidents of burn. Once wanted to do something to deal with the burn, but not yet understood about the correct way of handling. Therefore, today I will inform you about 3 steps of first aid on burns. And to start, I will explain about the definition of burn injuries, then I will mention the equipment we need, then I will mention 3 steps to treat burns, and finally I will summarize my presentation. Okay, ladies and gentlemen, first, what is burn injuries? Burn injuries are injuries caused by exposure of body parts with something that has a high temperature. It can be fire, electricity, boiled water, or something with hot surfaces. Burn do not cause serious bleeding, but burn cause a lot of body's fluid gas out. So, burn is one of serious injury. Therefore, burn have their own way of treating. The burn has 4 degrees of severity. For the first degree have characteristic. The wound is red, dry and painful, and the tissue damage includes the epidermis of the skin. Second degree, the wound has red color, painful and warm ballooning. And the tissue damage includes the epidermis and the half of the dermis. Next, the third degree. The wound has red or black color, painless and warm ballooning. And the tissue damage includes all of the epidermis and the dermis of the skin. The fourth degree is the severe burn. In this degree, the tissue damage includes the epidermis, dermis, muscle and tendons, painless, dry wound, and it has white or black color. Okay, next. To do first aid for burns, we need clean and cold running water with a temperature between 2 to 15 degrees. It can be water from faucet or water from bottles that can be poured. Any water as long as it's cool, clean and flowing. And then we need the clean wraps. Okay, ladies and gentlemen. For the first step is drenches the burns with cool water for 20 minutes. This is meant for preventing further damage and to make it easier to remove burn clothes. Based on WHO surgical care at the district hospital 2003, by drying the burn with water, it helps heat transport from inside to outside body parts. So, this way is so helpful to prevent further damage, and it helps to reduce the one-time reepithelialization. For the second step, if the areas of burns are limited, just drenches with cold water to reduce edema and pain and to minimize tissue damage. And if the area is large, after drainage the burn with cold water, apply clean wraps on the burnt area to prevent systemic heat loss and prevent hypothermia. Based on an article of First Aid Treatment on Burn Injuries by Cutler L. and Kimball R.M. that hypothermia is harmful for a body because it causes shock. So, to prevent it, do the warm after cold water treatment. And the final step. The first 6 hours after injuries is a golden period to treat. So, transport the patient with severe burn to the hospital as soon as possible to prevent more damage, because severe burn need further specific treatment. Okay, based on WHO on our first article, first aid of burn injuries by Cuttle L and Kimball RM, that 6 hours after injury is a golden period to treat so that there will be a perfect recovery. If you treat the burns, do not apply toothpaste, coffee, or powder to the wound, and do not pierce the balloon because it can cause infection and inhibit the recovery. Finally, in conclusion, let us be more careful about burn. When experiencing or seeing the incidents of burns, do not panic. Stay calm and take the right steps slowly and quickly in handling first aid of burns. And as soon as possible, wash the burn with cold water and transport to the hospital. Okay, I think this is enough from my presentation. Thank you for your attention and wassalamualaikum warahmatullahi wabarakatuh. Good morning.